Hello, hello, hello. This is Tooth Be Told. This is Dr. Walter Aka.
Y yo soy Dr. Horton y juntos vamos a empezar una clínica en México porque estamos cansados de la sistema de salud en los Estados Unidos. And for my brothers and sisters that need a translation, we're going to Mexico.
So this is why it's gonna be our last conversation. You don't outdo the host that co-hosts with you. You don't do that, right? You gotta talk to me. If we're gonna do Spanish, let me write some stuff down, okay? And then we both can act like we know Spanish really well.
Right.
Okay? Because everybody knows I know Spanish as much as I know. Can I go to the bathroom? That's
right.
That's all I got, you know. So next time you're gonna do that, you let me know.
Gotta let you know, right?
Because that made me look bad. I didn't like looking bad. That made me look bad. Because all I can say is C.
Just nod your head and say C.
That's it. C. That's all I got. God damn. Anyway, man. This is part 2.
Yes.
I had a lot of people, with our first one when we did basically why we think specialists are going down. We talked about perio, we talked about endo, we talked about ortho. And I had some friends of mine disagree with me. Okay. And that's a nice way of putting it. It's okay. It's okay. To me, I welcome any opinions, right? But I think what we're doing is we're not saying that this is going to happen tomorrow. What we're saying is this is where it looks like through our eyes, things are going. Right. There's nothing wrong with that. This is our opinion, right? There's nothing wrong with having an opinion. And so that was something that I talked about. And I talked to my friends who are orthodontists. I talked to my friends who are endodontists. And the funny thing is the orthodontists were like, yeah, I see this happening. I'm not even, one of my good friends was like, I'm not even sure if I would even tell my kids to do ortho or to do dentistry, because of where it's going, right? She said definitely not ortho. And then my endodontist friends were kind of like, "Oh, what do you know?" Right. What do you know? And I said, "Okay."
Was there anything specific that you said that they didn't like, or?
I think it was just the idea of us talking about, hey, you know what? Endo is being replaced by a lot of the same things that perio is being replaced with, right? Technology is getting better. CBCTs are getting better. And, having less to do from the dentist point of view, from a general dentist point of view, is making it easier. So remember back in the day, right? I'm going to say maybe 10, 15, 20 years ago, right? When you did endo, you did the gutta percha and you had to like side fill or, and remember that? And it took forever. And the lateral we basically put multiple gutta perchas, which are basically, the things that we fill root canals with. We had to put multiple of those and it took a long time because you had to hand file. And so time was kind of what was being wasted, right?
Right.
And what happened was a general dentist wouldn't get paid enough to spend that hour or two, right? So then we said, why would we do that if we can do a crown and get paid the same amount of time, for the amount of time and the price and everything like that, right? But as time has gone on, technology has always done what technology always does, which is get better. And people have found ways to make procedures shorter.
Right.
I remember, and I'm going to go back again. I might be dating myself, but I don't know yet. When you had to do a denture for a patient, I remember about 5 different appointments to do the denture cases.
Yep.
Now you're scanning dentures, and you're probably milling it in 2 appointments.
Yeah.
You see,
no more border molding.
No more border. Remember that you had to border mold and pour it up and send it to the lab. The lab gave you, the base for you to try it on, and then, border mold that and add more to it and try to get the vestibules. You did a lot. Now you just scan it, send it to the lab. The lab gives you back one denture. You try it maybe for occlusal fit or whatever it may be, and then you get your final product.
Right.
It's easier now. Time, it doesn't take as much time because you're not shipping anything off. You just send it through email or whatever it may be.
Right.
So just like with anything, time and technology has caught up to where it's easier. So the border or the application to entry, right? So basically, how hard is it to enter?
Right.
Has gotten easier and easier and has gotten less.
Yes.
So just like with anything, it's going to happen.
Did you have to cast your own restorations in dental school at all, even in preclinic lab?
Yes, in preclinical lab we did. We had to
We
learn how
had
to do
to.
that.
Do you remember the process of doing your wax up
Yes.
and spinning it in the
Centrifuge and then the hot molten thing, like just shot it
yeah,
in there. Yeah, yeah,
yeah.
yeah.
Then you had to then you take your porcelain and you had to paint it on and you had to
That's it.
bake it.
Yeah.
The
They don't do
human
that anymore.
element of all that process is gone now.
That's
So
it.
you have a CEREC machine or a lab has a mill. Literally what used to take hours for a single crown is 20 minutes.
Right.
And
And
it's all
you
machined and it's precise.
right. And there were, I mean, and I hate to say this, but you always used to, my mentor used to tell me, if you want really good crowns, the more you wrote, the more they would have to give it to the best ceramist in the lab or the best lab tech, right? Because they're like, oh God, we got another Dr. Aka case, and he writes, he wants A2 for the, the margin, and he wants this and that. The mid needs to be A4 blended in with the A3. You know what I mean? So like that's what he told me. So that's how I did it. I just wrote as much as I possibly could and went as much detail as possible. Now it doesn't matter. All someone has to do is literally sit in front of a computer and tell the numbers and puts all this stuff in there, and then the computer and the mill does everything for you.
Yeah.
I'm not saying that they're going to eliminate ceramics, but it's harder to find a school that's going to teach you dental lab tech procedures, right? So anyway, I say all that to say, you don't have to like what we're saying. You don't even have to agree with us.
Right.
But one thing that somebody said to me a long time ago is the truth does not need to be believed in order to exist. So let me say that again. The truth does not need to be believed in order to exist. You don't have to believe us. Right. But it doesn't mean it doesn't exist.
This you don't have to want to believe us. Sometimes I feel like people are in kind of a cognitive dissonance. They see it coming. That's it. But it hurts too much to believe that.
That's it. That's it. I'm sure at one point everybody was like, why the heck would I want a computer on my phone when I have my BlackBerry? And then we had the iPhone.
Hey, those Blackberries was tough though.
I'm not saying they weren't.
Man, sitting at the keyboard and you doing this? Listen, I miss those days, man.
Listen, I miss flip phones because those flip phones would last me like 2 weeks, one charge.
Right. No, that's true.
Right.
That's true. Yeah.
Remember at one point, this is the most infamous. At one point, Blockbuster Video had an opportunity to buy Netflix. I think it was $1 billion. And they were like, oh, we're not going to give them anything for this. Or I think it was less than that even. And they were like, why would we even waste our time with this?
Right.
Where have you seen a Blockbuster Video anytime soon?
Bro, I used to work at Blockbuster Video.
Yes, I did too.
2 years in high school. And it is so sad to see that entire industry is gone.
Yes. But
remember the excitement of the weekends, rushing, like trying to get early on a Friday evening so the movies wouldn't be sold out?
That's it.
Oh my gosh. The kids will never know.
But exactly, right? But now you can stream it online. So technology was coming. Yeah. Either you understand it and adapt to it and move on with your life and say, how do I utilize it? Or you can say, this doesn't exist. Right. And everybody else is going to use it. And then you're going to be sitting there looking and saying, how did this happen? Where I am a dinosaur. Yeah. I am ancient. Right. So again, I want we do all this not to scare people or not to make it seem, belittle anybody, but we're saying this is what we're seeing. Yeah. And then
we're saying about ourselves too.
Oh yeah. I mean, Perry, that was the first one we did.
That's the first one.
That was the first one we did. And so we did that on purpose to basically let you guys know we're not being biased. Right. We know what's coming our way. And so we have to be honest as well. And I tell this to residents and so forth, like, you better get your skills right when it comes to other things besides implants. Things that people don't want to do, osseous, soft tissue. How about implant failures, implant complications? Get good at those. Yeah. Don't just think that the stuff that was easy is going to still, that's a low hanging fruit.
Right.
And that's the first thing any technology is going to go after is low-hanging fruits.
Right.
Implants are low-hanging fruits. As much as you like to believe that you're special, you're not.
Yeah.
I've accepted I'm not special. I think my kids tell me, Daddy, you're not special.
Well, I think you're special, Will.
I appreciate you.
I heart you, Will. I heart you.
You know what? Thank you. Brotherly love. I appreciate that. You know what I mean? But no, that's where we got to talk about. So this time, and then I'm going to stop my rant and we'll just get to this. But this time we're going to talk about pedo and why we think pedo is in trouble, and OS and why we think OS is in trouble. And both of them actually, to me, have the same common, I don't want to call it enemy, but the same common problem. And so we'll get to that. So let's start with pedo. And I'm going to ask you this question. And if you don't know it, it's fine, right? But what is the hardest thing about pedo? And the reason why general dentists refer their patients to a pediatric dentist?
I'm going to guess patient management.
Patient management, behavioral management. Exactly. It is hard. It is hard. And that's why I have so much respect for pediatric dentists. Because one, 100%. I can't be on 24/7 like they are. Like I can't come in there, hey, little one, dibbity-dibbity-doo.
Little TikTok dances.
Yeah, I can't do any of that. I don't have the energy nor the patience for anybody else's kid. Right. I can act a fool for mine, but I can't do that for everybody. You know? But so I respect them and the energy that they have. Right. But here's the one thing that they always had, which was general dentists didn't want to deal with the kids because of behavioral management. It's hard. That's why they teach them, and pediatric dentists are really good at behavioral management. Trying to talk through kids about, hey, how do we do this? And doing all the different techniques, So now I say all that to say this. What if I could get rid of the behavioral management part of this whole entire situation? As a general dentist, would you want to do it? And I believe the answer is yes.
Yeah.
Right? And the way for me to get rid of this is by calling in backup.
Right.
And the backup is a dental anesthesiologist. If I put your kid to sleep, one, they've had a good experience because they don't remember anything.
Right.
Two, any work that they need can be done while they're sleeping.
That is true.
Right? Three, most of the procedures, and I contacted a good friend of mine who's a pediatric dentist, and I said to them, hey, what are the three biggest things that you do and how long do they take? Meaning how much you charge for it and how long do they take, right? And it was tongue tie, so frenectomies. Okay. Stainless steel crowns, they still do those. And space maintainers. And I said, okay, well, how much on average range do you charge for tongue-tied stainless steel crowns and space maintainers? And they said, and she, I looked it up as well. And the range went from $400 for tongue tie, $400 to $2,500. On average, about $800. Okay. And I said, how long does that normally take? And she's like, oh, if you have a CO2 laser, 5 minutes.
Right.
Parents are happy. It doesn't take that much time. And in all honesty, my brother, my niece, who is 5-6 months now, had a tongue tie, and she got hers released with a CO2 laser from a pediatric dentist in Chicago. And he was like, man, we were in and out like that.
Did they sedate her?
No, there's no need. There's absolutely no need, because all you do is just hold the baby. You do. I mean, literally that CO2 laser is incredible. And I've seen this with my own. It takes no time at all. You can put topical in that area and you just basically incise.
Wow.
Right? 5 minutes, done. $800.
Wow.
Okay, so that's even without anesthesiology. And that's the one thing a lot of pediatric dentists are starting to focus in on, is going to the OBGYN or I'm sorry, not OGB, OBGYN and pediatric pediatrician, and basically saying, hey, if there's anybody that is tongue-tied and you don't want to do it, send them to me.
Right.
And a lot of pediatric dentists are now making that a big part of their revenue.
Right.
And that CO2 laser is expensive, right? Like 40 to 50,000.
I
But
mean,
but with
in the
time,
realm of the toys that we buy, I could see that.
it's reasonable.
Yeah.
But the funny thing is, give it if you basically market your office to do this, parents are gonna, I mean, scramble to you. They're gonna
Right.
come to you in droves because they know, hey, I have this issue, or you can even point it out to them.
Right.
Like, hey, I see, I realized that, you were telling me, oh, you're having a hard time with lactation and so forth. Can I check to see if your baby's tongue tied? Oh yeah. Let's do this procedure. It takes you no time at all. And the anxiety for parents are always there because my brother kept calling me, asking me like, hey, how is it? Is it? I connected him with a buddy of mine. He explained everything. Oh, okay. When they went there, oh man, this was so much easier than I thought it would be.
Right.
Because that laser allows it to go fast. And there is no real bleeding, right? Because it cauterizes while it's cutting.
Yeah.
So you've basically now found the most productive thing you can do in 5 minutes.
How many did your friends say that they do in like a typical month? Did you ask?
So when he first got his laser, and this is another person that actually does it, when he got his laser, he was probably doing about 10 a month.
Oh, wow. Okay.
Yeah. And that's, I mean, people do way more.
Right.
Some people do way less, but he was like, yeah, initially it was like 10, but then he kept building, right? The more you do, the more you get referred, right? You go on Facebook and join the mommies of whatever location you're at, and someone says, oh, my baby.
That's clever.
Okay. Oh, yeah, my baby got it done here. And then, oh, I have tongue-tied issue. Where do I go? Oh, yeah, go to Dr. Smith. They do that all the time. Oh, my baby had it done. Because I know for sure my brother was like, yo, that was easy.
Right.
And then I said, oh, so was it worth it financially? He's like, bruh, in a heartbeat.
Yeah.
Because again, when it comes to kids, we take care of kids before we take care of ourselves.
Always.
That's it. So now we basically found the magic ticket, the golden goose, right? Which is tongue tie. That is the one that everybody should aim for. General dentists can easily do that. Okay. Stainless steel crowns and space maintainers. That's when you need a dental anesthesiologist. A kid comes in, they need stainless steel crowns. They probably have multiple cavities, right? And apparently to do the stainless steel crowns, it's break the contacts, bop, bop, fast, reduce occlusion, get rid of any rounded ends, and you're done. And you put the crown on there, squeeze it on. That's it.
Add a pulpotomy if you need it. I had when I first graduated, I worked with a pediatric dentist seeing his like teenage patients 1 day a week.
Okay.
And I shadowed him once in the OR. And yeah, anesthesiologist would put the kid to sleep. He would do 4 pulpotomies, 4 stainless steel crowns in like 10 minutes. He just had a system, and the assistant knew, so he didn't even have to look up, but the assistant knew his patterns and it was just like boom, 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 boom. And I mean, you can only imagine how much that charge was. And it was literally 30 minutes worth of work under anesthesia.
Right. And don't forget the stainless steel crowns range from 100 at the low end to about 300.
Yeah.
Right. So you did 4 at 300. That's right there. You just did $1,200 in 30 minutes.
Yeah.
Right. And remember, patient is sleep. So behavior management is gone.
Yeah.
Right. And if you do that, and let's just say you had to take some teeth out because you had to extract some of those teeth, you put a space maintainer in there. The space maintainer, again, that's 5 minutes.
Right.
Range is $75 to $150.
Yeah, that's easy money. And I'll give you an example. One of my good buddies, Dr. Stephen Delisle, he works out of Las Vegas, but we were in dental school together. He did an anesthesia residency. And then ended up partnering with some other doctors. I don't know if all of them were pediatric dentists, but a lot of them were general dentists. And they opened up a network of offices. And now, for the most part, he just sees kids. And he even does some of the dentistry, I think, as I understand it. But you're right. I mean, for both kids and special needs, once you bring an anesthesiologist into the equation, then anybody can do it.
That's it. And I hate to say it like that. I'm not trying to belittle anybody's years of training or whatever it may be. And your argument could be, you know what, we do years of training and we're specialized in this, and that. All I'm saying to you is If a general dentist doesn't want to go through the years of training and wants to take courses, they can easily do this.
Yeah.
Easily. So to me, again, I'm looking at this and going, what is the easiest way to get and you know, basically get into pedo? And this is it. You get rid of behavioral management, you have an easy path. Anybody can do it.
Yeah.
Anybody can do it.
No, and I think that I probably had one office that was close to enough other offices that had pediatric dentists, where we ended up losing the whole family because they were like, well, it's just easier if it's just one place for all of us.
Yeah.
And, you know, they're able to see our kids, so we're just going to be there for a while.
That's it.
You know, and so you're right. I think being able to see kids is a plus. And we, like we said in the last video, everything, our industry is contracting. And so we're all fighting over scraps now.
That's it.
Insurances are paying less.
You're
the
right.
economy, people are hurting in the economy. And that's going to make us do more to get out of our comfort zone because we got bills to pay.
That's it.
And, you know, hopefully we're doing it right. But yeah, we are going to be fighting over those things in that gray zone of, well, technically I can do that. Let me start doing that.
Right. And again, remember who's a gatekeeper for all this? General dentist. General dentists are the gatekeeper because they're the ones that refer to us, despite how important, how special. And I use that a lot. And I mean, I'm trying to be facetious, but I'm trying to be funny, right? Because, you know, we call ourselves specialists, but we're not that special because the gatekeeper are the general dentists and we need them as much as they need us, right?
Yes.
Because there's stuff that we do that they cannot do or don't want to do.
Right.
Right. So now imagine if you basically lower the hurdle for entry. You're not really special. You're not that special.
No,
and I hate to say that.
And maybe we never were, right?
Maybe.
You know, and I say we like I'm already done with residency.
No, but I know what you mean.
But and you know, because think about it. If I do a post of a beautifully placed implant, right, and the healing collar, patient's gonna look at that and be like, okay, what's that? Right? It's not until the general dentist makes that beautifully matching, you know, with the translucent incisal edge and the characterizations. It's not until the restorative dentist does that then my implant looks good.
Right.
So as much as they need us, we also need them.
Yeah.
And I think that what's going to hurt specialists is the relationships that we didn't build over the years.
Oh.
Because there is some animosity between the GP culture and the specialist culture.
Yes.
And that, I think that's going to bite specialists in the butt,
right?
Because now more and more we need them.
That's very true. You're 100% correct. That is so true. Right. And it's one of those things where I think, you know, remember, was it 2020, 2021, whenever like, you know, people were, oh, I'm a guru with, you know, investing and all this other stuff because the market was going up.
Yeah.
You could have sneezed and picked a name. Right. You could have had your dog pick a name and it was going to go up. Right. It's not until we have a hard time that then we basically distinguish ourselves from who actually knows what they're doing versus. Right. And if we're going to go through this tough time with increased interest rates and so forth, we're going to start differentiating and we're going to start to realize, hey, this is the general dentist is going to say, well, this is the person that I trust. This is the person that has gotten me out of some trouble. This is the person that picks up my phone call and answers my questions. This is the person that doesn't just dismiss my questions.
Right.
I'm just saying.
Yeah.
If we're trying to be helpful, this is it right here. We're giving out gems here, but you can listen or don't. I mean, I'm going to bed tonight. Okay.
Hey, they got to pick up what we put down, right? Otherwise. So what's going on? What's going on with OS? So we talked about everything except OS.
Yep, OS is the last one, and I think this is my opinion. So OS, the biggest problem with OS is the same thing that pedo has, right? If we can control for the things that make it difficult, which is patient behavior and patient management, then we'll be fine. And again, dental anesthesiologist, I feel like you should give me a cut of everything that you do because I am telling you, dental anesthesiologist it is the greatest thing. It is because they allow patients to feel comfortable, because we have an increased amount of, and I'm not sure if you're seeing this, a lot more, I don't want to say anxiety in patients.
Mm-hmm.
And if we sedate them or give them that option, they're going to take it.
Yeah.
And OS had the market.
Yep.
When it came to sedation, had the market cornered.
Right.
You want to be put to sleep, you go to OS.
Right.
But now, because I mean, you know, in all honesty, OS, the stuff that OS does the most was thirds.
Yeah.
And they usually did it on teenagers.
Mm-hmm.
And what's the one thing about thirds and teenagers? The root hasn't completely formed. So when you take it out, it's not that hard.
Right.
Okay. It's not like a 35, 40-year-old where the root's fully developed. It's close to the IA, you know, and it's curved and so forth. Right. On kids, their bone is a little more malleable. You can go in and get those thirds out so quickly.
Yeah.
So now the question is, what's the hardest part? Sedation.
Right.
You hire dental anesthesiologists. They come into your office. They take the charge. They take responsibility for any issues with, you know, patient management, any medical issues. They take care of all that. That's their responsibility.
Right.
Now all you focus in on the procedure part of it.
Right.
Right. And I know general dentists, and I mean, it's funny. I see it on my social media, my Facebook, that are advertising, "Hey, general dentist, pal of mine, do you want to learn how to do thirds?"
Yeah.
And then I'm like, oh, first I thought, oh, that's an oral surgeon. Nope. He's a general dentist that went to residency and really is good, I guess, based on what they're saying.
I think I know who you're talking about, actually.
I bet you do.
Because I met him as a brother, right? We won't say names, brother. Yeah.
We're not going to say names. Yeah. No one's paying us.
Yeah, he's actually a really cool dude. I met him years ago. We kind of interacted online, and then I met him at the NDA convention.
That's it.
But that is his niche, and I kind of bonded with him a little bit because that was my niche when I came out, was wisdom teeth.
And your niche when you were a general dentist was teaching other general dentists what?
Surgery. Yeah.
Right. So we're teaching surgery. We're going to people we trust, and I know a big DSO, no names, a big DSO who is now teaching general dentists implant placement.
Right.
They have multiple courses, weekend courses, and so forth. Right. It's like a few months of training, and the person who's leading it is a general dentist.
Yeah.
Okay. Nothing wrong with that. To be honest with you, I don't see how, you know, I'm any more special than a general dentist, because I believe that some general dentists, I mean, have the level of skill that's very impressive.
Very.
Right. And I remember I saw your cases before you went to perio, and I was like, bro, what are you doing going to perio? What are you doing this for? Right. No. It's all, the truth has to be told, man. And so that's what I'm saying. It's like the surgery part, once you've learned it, you realize it's, you know, we still need to continue, but it's not as difficult. So if somebody who's a general dentist wants to get paid between $200 to $1,100 to take thirds out, and they have sedation, dental anesthesiologist comes and sedates the patient.
Right.
Then what are we talking about?
Or
implants?
I'll one up that. I did my IV moderate sedation training back in 2014.
Mm-hmm.
And I did it with Stanley Malamed, Amanda Okunde, Ken Reed, so all the big names in anesthesiology. And I love moderate sedation. And it is weird because I didn't lose too many patients before, but it was probably about maybe 30% of the patients that I treat and plan for extractions of wisdom teeth, I would send over to the OS because they wanted, to be sedated. After I got my license, I hardly sent any out unless they were extremely, extremely complicated.
Right.
And even though it was just moderate sedation, because it has that amnesia effect, they all assumed they were sleeping. Regardless of the fact they were completely awake, had their protective reflexes and their breathing. But it was a game changer. I mean, patients absolutely loved it.
Right. And so now imagine if you take away the liability of you sedating the patient, and you can just focus on the extraction, the surgeries. Right. Whenever I have a big case, I call my buddy who's here in Houston that travels around. He's a traveling anesthesiologist, and he deals mostly with pedo, but he'll be like, hey, I got you. Well, let me go ahead and come in and we'll set up a half a day.
Right.
And he'll come in, sedate, man, I'm listening to my music even more.
Right.
I'm enjoying life even more.
Right.
The hardest part is training your assistants to understand how to work within that area, because again, the reflexes are limited.
Right.
So we have to do really good job of, suctioning and so forth.
Right.
Right.
Yeah.
And that's it. So now you've eliminated that part.
So it sounds to me like you're saying we should have gone dental anesthesiology residency.
Well, I would never. I'm not gonna lie. I would never. I have friends that did it, and I respect them. I would never. I could not. I love dentistry too much. I could not.
I thought about it because one of my closest friends and mentors, Doug Jackson, he's out of the University of Washington. He was a dental anesthesiologist for years. He trained at Pitt.
Yeah,
and
that's exactly where a lot of people, and everybody knows that I went to Pitt. So we graduated knowing anesthesia. We did the rotations and so forth, and it is a great school for dental anesthesia. I got to shout out my Pitt people.
Yeah.
It's a great school for dental anesthesiologists, Dr. Giovanetti and all those people, man. I'm talking about like they were the ones that fought to get dental anesthesiology to become a specialist, actually
to be a recognized
specialist. Thank you. Recognized specialist. Yes. So shout out to Pitt real quick.
Yeah. But Doug Jackson, he's just always been a very big inspiration for me. And so I kind of wanted to follow in those footsteps. And, when it was choosing between perio or trying to go to OS or anesthesiology, unfortunately, a lot of the anesthesiology schools closed. So there's none on the West Coast anymore. So I think there was UCLA and one other one.
Okay.
But now you have to go east. That was too far from me. And like you, I can't give up wanting to do stuff with my hands.
Right.
I love being in a procedural position.
Right.
And not just a monitoring position.
That's it. Yeah. And I mean, again, I'm not saying that that's, it's not for everybody. But yeah, man. So to me, that is the biggest thing. It's, if you can lower the bar of entry, you're fine. People are going to want to jump on low-hanging fruit, right? Low-hanging fruit, as much as everybody thinks they're special, again, there are certain things that I'm sure you don't want to deal with from the OS point of view. I'm sure there's certain things like no OS is going to want to do. I mean, no general dentist wants to do any kind of Lafort. But the funny thing is, not a lot of OS want to do Lafort either, because that involves a hospital, and it's a long procedure for very little pay.
Right.
We know this, right? So thirds, implants. That's like, if you ask a lot of OS, that's their niche. That's basically where the sweet spot is. So general dentists can do that.
Yeah,
they can do that.
Yeah.
So again, I'm gonna end it here, but I think I've made a good case for, we have to start getting better at this, guys. We have to start seeing what's coming our way versus getting, run over by the 18-wheeler. You might as well just move out of the way. Remember that Austin Powers? Was it Austin Powers where it was a slow moving steamroller or whatever, and the guy was like in the way? He's like, no, and he kept standing there and he kept waiting, and he's like, no,
right.
And it was like, he's like, the guy's like, move out the way. That's basically what's happening. We see something coming our way, but we're just like, no, let's pretend that it's not there. It's gonna come, and we just have to be honest with ourselves and say, what do we need to do? So for OS, go ahead.
No, I was gonna say, and there's nothing wrong with, like you said, we have to get better, right? So if you're already specialized in something, but now the industry's advancing and a lot of people are able to do what you do, now you just got to get even better.
That's it.
Right. So like you said, whether it's soft tissue management, dealing with, as far as implants, we know that, almost half, 40+% of implants have some type of mucositis. And, depending on the study, 10 to 20% will have peri-implantitis.
Right.
Like you said, specializing in dealing with failing implants. And that's something I've definitely been adding
Me too.
to my game. But you see that with, look at the special forces, right? You have the Navy SEALs, but then within that, they got SEAL Team 6.
That's it.
Right. So there's always going to be room to specialize more
into something else. Yep. You're absolutely correct.
We just have to adapt to that.
That's it. Yeah. So again, this is not, not any advice, but it's a recommendation, right? We're not going to give anybody advice because no one wants to listen to advice, but we recommend lightly.
Well, this will be a good "I told you so" episode. So 20 years from now, when
There you
things
go.
change, we'll be even grayer than we
Even-
are now. But we'll be like, "Yeah, I got this footage. Let me show you. I saw it coming."
We're gonna be all bitter. We're gonna be like, I knew it. I knew it. You know what I mean? And everybody's gonna be like, oh, there goes the grumpy pundits again.
Right.
But yeah, no, that's it, man. I wanted to, finish up with this and kind of go over, part two of why I think and went down the list of every specialty and why we are in trouble.
Right. Well, what I
so
think we should do to end the episode? We should intro what we might be talking about next.
Okay.
So I did my little Spanish flair in the beginning. It's because me and you are. Listen, you leave it to me. I'm always gonna throw a little bit of suave nature.
I just wish you would have told me. So we both look good.
Right.
So I could have Google Translate something.
Right.
It would have been like, so yo usted oh God. At least you could have done that. You know what I mean? Give me a little something to work.
No, but next time I definitely will. So we are planning soon to break down a video about medical tourism, specifically to this city in Mexico. I think it's a great video. I don't know if you want to shout out the videos to people that might want to watch the whole thing ahead of time.
Yeah.
But we'll break down a few pieces and kind of give our take on it.
Right. I believe it's like what, AJ Plus. If you search, if you just Google, if you go on YouTube and just search, dental, why are people going to Mexico for dental work, right? And then just put AJ Plus, you'll find it. It's like the first thing that comes up, AJ Plus. I would highly recommend watching it. It's a really good documentary. I'm not sure. Would you call it a documentary or like I don't know what it was. It's not long enough to be
one of those special news investigations,
right?
Like 15-minute piece on.
It's
on
really good
tourism.
because it breaks down exactly why people are going to Mexico to get work done, and most of it, from what I remember, it's about cost. But the one good thing that this video did was explain it from the dentist point of view too, as to why things are so expensive in the US.
Right.
And, of course, me, I hate insurance. So insurance is in there. Tuition, can't stand schools. Tuition's in there. And so they break it down really well. So if you guys can honestly go check it out, it's on YouTube. After you like, subscribe, and all that stuff that we want you to do with our video, you know what I mean? Because we want people, and if you want to share this with your friends and whoever wants to listen. This is for everybody. It's not just for dentists. It's not just for assistants. It's not for anybody in the dental field. It's for everybody. Because in the end, we always say the same thing. We want to challenge dentists so we can continue to be better, right? So as a patient, I want you to challenge us, and that's why we do this every time.
My daughter listened to 2 of our episodes and she thought we were kind of amusing, and for a 19-year-old to say that's actually a big compliment.
And the funny thing is it was more than 5 seconds.
Right.
So she's special. Let me tell you right now.
Yeah.
She is special because she still has an attention span. So that's amazing. So tell her I said that. Shout out. She's definitely special because she has an attention span. Because I'm telling you, a lot of people don't have the attention span. Listen to our videos for that long, by the way. You know what I mean? But you can listen to it while you're driving to work, if you still do that, if you go to work. If you don't, while you're at the gym, probably doing squats or whatever you're doing. And only that, it seems like.
Hip thrusts. It's leg day every day.
Leg day every day. Listen to us while you're doing leg day. Just listen to us. We'll educate you while you get your legs right. But anyway, thank you as always. And again, indeed. Please, if you're going to talk Spanish, bring me into it.
Let the host know.
You made me look bad. The way you did it made me look bad.
Well, listen, I'm sure there's some languages that you might know of better than me.
You know what? The funny thing is Fonte, so only my Ghanaian people would understand, and it's not as exciting when you already know what I'm going to do.
Well, so you next episode, surprise me.
Oh, nobody's gonna be like, what is he talking about? You can't even Google Translate this. So, all right, man, we'll talk later, man. All right,
sounds good, man.
All right, brother.